Hello, good day. My name is Dr. Marcus St. John. I'm an interventional and general cardiologist here at Baptist Hospital in Miami. And we're going to talk for the next few minutes about heart disease in general, but more specifically about some things that may pertain to living and growing up in the Caribbean. As some of you may know, I was born in Grenada and grew up in Barbados, so I have a feeling of what it is like to be in the Caribbean and what some of the unique stressors and risk factors of the Caribbean may be. One of the things I wanted to touch on first, in no particular order, is the impact of excessive alcohol use on the heart. Very often, perhaps around sporting events or at holidays or just hanging out and old talking, as they say, alcohol is a part of life in the Caribbean. But alcohol does have a downside, and it can impact many things, not just the heart. I think people are more aware of the impact potentially of alcohol on the liver in terms of cirrhosis. And then alcohol in excess certainly can have other social and economic impacts. But alcohol above the use that we term moderation, for most people that's more than one or two drinks in any 24-hour period, does have detrimental or negative impacts on the heart. And it does so in a few ways. Excessive alcohol is a contributor to being overweight, and being overweight is a big risk factor for heart disease and stroke. Excessive alcohol leads to increase in the triglycerides, which are a type of fat in the bloodstream. Excessive alcohol is a big risk factor for high blood pressure, and high blood pressure is a very big risk factor, in fact the biggest risk factor for stroke. And excessive alcohol is very often a contributor to irregular heartbeats. So one of the most common types of arrhythmia or irregular heartbeat that we see is something called atrial fibrillation. Atrial fibrillation has a lot of downsides, the biggest one of which is that it can induce the formation of blood clots in the heart, which are another big risk factor for stroke. So a lot of negative things that alcohol does to the heart and the circulation. And it also can act just as a depressant to heart function, so it can be a cause of weakening of the heart muscle, something called cardiomyopathy. So all of these things really should be strong reasons why you need to limit your alcohol intake and avoid excessive alcohol, even just occasionally. So if you say, well, Doc, I don't drink except on the weekends when I do 6 beers, that is still putting you at risk for many of the things that we spoke about. So one of the ways I like to tell my patients about alcohol is that I tell them that you get a coupon for your alcohol. You get 1 coupon a day, but you can't save your coupons up and use them all on Sunday, because then you're going to be increasing your risk for many of these things. So if you don't use the coupon for Monday, then you lose that coupon. So I think that's a good way for you to start thinking about your alcohol consumption and to really do so in moderation. What we tell our patients is, if you drink, do so in moderation. There are some benefits to the heart from alcohol use, but those benefits only are incurred in moderate amounts. So moderate means, in general, for the average sized woman, 1 drink per 24-hour period. For the average sized man, 1 to 2 drinks per 24-hour period. So the next time that you are thinking about drinking, just remember all of the negative impacts it really can have on your heart and your heart health, and try to keep that to a limit that is appropriate for your age and your gender. Okay. One of the other things that I think is very common in the Caribbean is this general, I don't want to say dislike of doctors, but a bit of fear of the unknown. So people, if they feel well, don't go to the doctor. And this can be very often for men who can be hard-headed, but also for women who find a lot of other people and things to do to take care of other than themselves. For both genders, I would start by saying that the doctor shouldn't be a place that causes you to be afraid, because a lot of the things that we might find, whether it's high blood pressure or diabetes, all of those things are scary. And you say, well, if I don't feel bad and I don't think about it, maybe I don't have it, or it's not that bad. But a lot of them, you really have to get checked by someone to know that you have it. And they can be very often simple, straightforward things that you can do to improve your health. So you really have to get your blood pressure checked, because you won't know that it's high unless you get it checked, but it could be increasing your risk of stroke, increasing your risk for blindness, increasing your risk of kidney disease and needing dialysis. And if it is high, there may be simple things that your doctor can point you towards that you didn't even know was affecting it, such as drinking too much or adding too much salt to your food. Similarly, with high cholesterol, you won't know that until you do a blood test. Now, the blood test, most of you can do a blood test, most of us, I should say, because it's just a simple blood draw that even for someone who is squeamish is not that hard to get through, and it gives us information. Again, you may be thinking, well, gosh, if it's high, I have to be on medicines. No, you might just need to start pushing away the dessert plate, or instead of a big slice of cake, a smaller slice of cake. So don't assume that it's always going to be bad news, or that it is bad news, that if it is bad news, there won't be anything to do but take medicine. Because there's a lot that people don't understand about their health that just a conversation like the one that we're having right now can be very helpful in changing. So going to the doctor is important, or it could be a nurse, it could be the health clinic, it could be a nurse practitioner, sometimes it could be a health fair, because to take action you need to know your numbers, and that's something that you will have seen on other places on this website and in general. You have to know your numbers to take action. So you have to know your blood pressure, you have to know your cholesterol, you have to know your weight, so that if you know it, you can start taking steps to improve it, to change it. What we see very often with women in particular is they spend a lot of their lives taking care of other people and not attending to themselves. And I see this every day in my practice. So women in their 50s come in, they're stressed out, they're taking care of their kids, sometimes their teenage kids, they're starting to take care of their parents who are becoming ill, and all the while, all that stress and all their other risk factors have led them to not exercise, to be overweight, to have high blood pressure, to have high cholesterol, and you will not be of any use to any of your loved ones if you really don't take the time to take care of yourself. So the caregiver has to take care of herself so that she can effectively take care of others. One of the problems that many people cite, including women like the ones I'm describing, is that they just don't have the time. But you have to make the time and realize that it takes only 30 minutes to walk for 30 minutes a day, and it doesn't have to be 30 minutes all at once. It could be 10 minutes 3 times a day. If you think of it in those terms, you should be able at some point in your day to just stop and walk for 10 minutes. And the other thing that's important, especially with people who are being pulled in many directions, and even life in the Caribbean is becoming, in many instances, a little more hectic and a little faster pace, is to realize that there are negative aspects to this chronic stress that we all face, so that the constant motion, the constant connectivity, the bills, the economy, your sick parents, the children that are acting out. And you have to remember and realize that stress does take its toll on the body. And I see it again a lot of times in my office. So stress may be contributing to the chest pain that you're having, and it may have very little to do with problems specifically with the heart, but a lot to do with the stress. It contributes to high blood pressure, it contributes to poor eating habits, and in some ways that are still being understood by research, it can contribute directly to the risk of stroke and heart disease. So realize that stress matters, and think of ways to try to address it in your own life, whether it is listening to music at the end of the day, whether it is learning to deep breathe for 5 minutes a day, whether it's taking a swim early in the morning. Look at your life and see where are the opportunities to address the stress, realizing that none of us thinks that you can eliminate stress entirely, and stress has its role in surviving and doing well, but chronic stress and overstress do have big downsides on your heart health and your health in general. Thank you.